Hello, everyone. Semi-retired Bob here. I talk about the carnivore diet, all things related to the carnivore diet, and miscellaneous odds and ends. Today, at the request of several people in my comments, I'm going to go back over all of the pain pills that I used to take. There's somebody commented, What were you taking? Was it over the counter stuff?" That kind of question. So I'm going to go over all that today, but I'm not going to make you just sit here and look at my ugly mug while I read all this to you. I'm going to insert what I did earlier today. As most of you know, I've been working on clearing out a section of my backyard, and I've been stacking the branches out of the corner of my fence on my back porch. And today I started the cleanup process of all the branches that have accumulated there over the summer. I still have some more to clean out, but I need to get the back porch cleaned up before I go on to the next section. And time is starting to be an issue. So I decided to do some work on that. I'll throw several clips in there. My shoulders are a little bit sore now because, as you'll see, I used the loppers a lot. I still have a lot more to go, but I have discovered, I talked about in yesterday's video how my spinal stenosis is probably always going to be there because I was working bent over and using my shoulders and back and legs to run the loppers. I could do it for 15 to 20 minutes at a time, but I did manage to fill up 2 big yard bags full of clippings. So I will insert those here while I read this stuff to you. The first drug I was taking was called Lyrica, and I was taking the maximum dosage of that. I'm looking off to the side because I can read it on the big screen better. According to the search for Lyrica side effects, it says Lyrica is a medication used to treat pain caused by nerve damage due to diabetes, shingles, infection, or spinal cord injury. It's also used to treat pain in people with fibromyalgia and certain types of seizures. Some of the common side effects of Lyrica include drowsiness, dizziness, dry mouth, constipation, difficulty concentrating, and weight gain. Weight gain. Serious side effects are rare, but can include blurred vision, unusual bleeding, bruising, unsteadiness, confusion, muscle pain, tenderness, weakness, swelling of hands, legs, feet, and signs of kidney problems. Kidney problems. If you experience any of these serious side effects or have any concerns about your medication, please contact your doctor immediately. It's important to note Lyrica may cause drowsiness and dizziness. Therefore, it's recommended to avoid alcohol and other drugs that make you sleepy while taking the medication. It's also important to consult your doctor before stopping the medication. Please note that this is not an exhaustive list of side effects and precautions. Okay, that's Lyrica. And because the maximum dosage of Lyrica was not letting me function, I also filled in the gaps with Tramadol. Let's read what it says about Tramadol here. What is Tramadol? Tramadol is a strong pain medication used to treat moderate to severe pain that is not being relieved by other types of pain medicines. Tramadol is a synthetic opioid and acts in the brain and spine, central nervous system, to reduce the amount of pain you feel. The extended release form of Tramadol is for around-the-clock treatment of pain. This form of Tramadol is not for use on an as-needed basis for pain. Warnings. Seizures have been reported in patients taking Tramadol. Your risk of seizures is higher if you are taking higher doses than recommended. Seizure risk is also higher in those with seizure disorder and those taking certain antidepressants or opioid medications. Tramadol should not be used if you are suicidal or prone to addiction. You should not take Tramadol if you have severe breathing problems and a blockage in your stomach or intestines, or if you recently used alcohol, sedatives, tranquilizers, narcotic medications, or an MAO inhibitor. I don't know what an MAO inhibitor is, but it has a list of things I can't pronounce. No, there's nothing on that list I can pronounce. Tramadol can slow or stop your breathing. It may be habit forming. Misuse of this medication can cause addiction, overdose, or death, especially in a child or other person using the medicine without a prescription. Keep this medicine where others cannot get to it. Tramadol should not be given to children younger than 12 or anyone younger than 18 years who recently had surgery to remove tonsils or adenoids. Let's see here. Taking tramadol during pregnancy may cause life-threatening withdrawal symptoms in the newborn. Fatal side effects can occur if you use this medication with alcohol or with other drugs that cause drowsiness or slow your breathing. Let's scroll on down here. To make sure tramadol is safe for you, tell your doctor if you've ever had breathing problems, sleep apnea, liver or kidney disease, urination problems, problems with your gallbladder, pancreas, or thyroid, a stomach disorder, or mental illness. Let's see if there's there's the dosing information. Let's see here. Here we go. More tramadol side effects. Get emergency medical help. If you have signs of an allergic reaction to tramadol, hives, difficult breathing, swelling in your face or throat, or a severe skin reaction, fever, sore throat, burning in your eyes, skin pain, red or purple skin rash. Tramadol can slow or stop your breathing and death may occur. A person caring for you should give something I can't pronounce or seek emergency medical attention. Let's see here. Tramadol may cause serious side effects. Call your doctor at once if you have any noisy breathing, sighing, shallow breathing, breathing that stops during sleep, a slow heart rate, lightheaded, feeling like you might pass out, seizure, low cortisol levels, nausea, vomiting, loss of appetite, dizziness, worsening tiredness or weakness. I can tell you I never had loss of appetite. And then under the common side effects may include constipation, nausea, vomiting, stomach pain, dizziness, drowsiness, tiredness, headache, and itching. It's not a complete list, but that's what we've got there under the listing for tramadol. So what I took while I was, just 16 and a half short months ago, I took the maximum dosage of Lyrica and filled in the in-between slots with tramadol. So yes, I was taking a lot of pain medicine. I can't tell you how long it's been since I have taken a pain medicine at all. I don't even take aspirin or Tylenol or anything like that anymore. I won't say I have no pain, because as I discovered while I was out working in the backyard, my spinal stenosis does still hurt when I do a lot of bent over working. But I figure a little bit more of that. And as I continue to strengthen my muscles back there, that more of that will go away. That's what I've got for you today, folks. I'm going to go ahead and let these videos run just a little bit longer, and I'll talk to you at the end of it. Well, I hope you enjoyed all of that. As you can see, I am out working in the yard. That's one of the things I could never do before. And all of those sticks from the things growing in my backyard and through my fence are a result of several years of not being able to do my own yard work and not even being able to get out in the backyard and look at what the yard service that I had hired was doing with the money I paid them. They obviously, I wish I could go back and tell them I need about half my money back, because they certainly didn't do a very good job of it. They kept the grass cut, but they certainly didn't trim anything like they were supposed to. That's what I've got for you today, folks. I hope you enjoyed this quick little video. Don't forget, get out there, be 1% better. Today, tomorrow, every day. Have a great day, folks. I'll see you in the next one.